So the United Nations says that there's a high prevalence of mental distress worldwide because of the coronavirus pandemic, especially amongst healthcare workers, as you would expect, and children as well, which is, not surprising. We're going to talk to Dr. Daniel Bober. You're a psychiatrist, doctor, and you said that the second wave of the pandemic is already here. And you're not talking about the coronavirus pandemic. You're talking about a mental health pandemic. What are you seeing with some of your patients?
Well, if COVID-19 is anything, it's a disease of loneliness, right? It's a disease of isolation. So you have healthcare workers who are being isolated from their family or friends because they're afraid of catching it from them. You have patients dying alone, also isolated. So it's really the loneliness that makes this disease so cruel. But what I'm seeing in my own patients is an increase in depression, anxiety, insomnia, and maybe if they were using a glass of wine to take the edge off, now they're using a whole bottle. So it's definitely something that's impacted them pretty hard.
And doctor, though, I'm very curious because in my mind, and as a layman, I would imagine that it's not just one thing. There are multiple factors that will affect the mental health of people in this country, especially this year in 2020. For example, you're talking about the protests that we've seen in the streets, and yes, perhaps they were sparked by the killing of Mr. Floyd and others recently. But for a lot of people, this has been an ongoing stress to their well-being that most people have had since the day they were born, since the day they came into this world being born black. They've dealt with the pressure and the stress of all that encompasses. On top of that, you now have this pandemic, which has disproportionately affected black people. And now you've got the protests and you see the violence that is happening in the streets. And finally, you're going to worry about whether people who are out there protesting are going to get sick. If they didn't get sick the first time around, are they going to get sick this time around?
Right. And ironically, the people that are most affected are also the minorities and the African-American communities. So it's the perfect storm. It's a confluence of factors. And there's also the economic despair. So you've got all these moving parts coming together to create a catastrophic situation.
So how would you say that mental health issues have sort of changed as a result of the pandemic? I remember sort of very early on when everything was shut down and it was completely sort of unfathomable to many, many people that certainly for us, Vlad, that you would be able to work from home in a profession like this. There was this sense that a change was afoot and we didn't know really what that was. Now this sort of change is starting to feel normal, but I think there's still a certain level of uncertainty and a lack of confidence in institutions that we once felt we could depend on. What do you think is sort of the underlying thing that's leading to people having, as perhaps a mental health crisis?
Well, I think there's a mistrust in the system, and unfortunately, the virus has become politicized. And I tell people all the time, this is not about ideology, it's about biology. It's not about politics, it's about public health. And so we need to be supportive of each other, and we need to restore faith in institutions. And I think because there's been a lot of misinformation and there's been a lot of confounding factors, that people have lost faith in those systems to support them.
All right, Dr. Boba, thank you very much. As always, we appreciate your time and your insight. Really, really
My pleasure,
interesting
Vlad
stuff.
and
Thank you.
Take care now.